Today I'm going to talk about calcium disorders. Of note, there are two calcium disorders we are concerned about: low calcium and very high calcium. The calcium in our body is principally stored in bone, or skeleton that is. 99% of body calcium is within the bone. And calcium has a variety of functions in the body. It is used for muscle contraction, bone mineralization with phosphate, and any process in the body requiring exocytosis. How is calcium in the blood? Well, calcium can be bound to proteins, principally albumin, and 40% of calcium in the blood is bound to albumin, and 10% to other proteins, and 50% is free ionized calcium. And this is the calcium that can be physiologically active and can be influenced by a calcium regulation hormone. And the normal amount of the ionized serum calcium is 1 to 1.25 millimoles per liter. And the amount of bound calcium in the blood is important because it is influenced by the pH of the blood. In low pH, less calcium will be bound to albumin, and in high pH, more will be bound. So in alkalosis, we get more bound calcium. And it's very important to know the normal range of calcium. The normal range is about 2.12 to 2.65. Of course, looking at different texts, you'll get different figures in and around that. And when we talk about calcium regulation, we are talking about three main organs. We are looking at the bones, the kidneys, and the intestines. And it's also very important when you're looking at calcium results to look at the corrected calcium, because as I've said before, 40% of calcium is bound to proteins in the blood. Well, 50% is bound to proteins, with 40% bound to albumin in particular. And diseases that lower the level of albumin in the blood, such as cirrhosis, can increase the level of active calcium. So we really need to account for the amount of albumin in the blood. And there's different hormones that will regulate the calcium to prevent it getting too high or too low. The first one I'm going to talk about is parathyroid hormone. And the parathyroid hormone is secreted by the parathyroid glands, and it responds to increased calcium. Well, no, it responds to increase the calcium, should I say. So, parathyroid hormone will increase the calcium in the body, in the blood. So if you have a patient with low calcium in the blood, in the serum, you would expect parathyroid hormone to be released, and it to work to try hard to increase the calcium, the serum calcium. And how does it go about increasing the serum calcium? Well, 4 actions, 1 related to the bone and 3 to the kidneys. It causes osteoclast to break down bone to release calcium, and this will increase serum calcium. And it also causes reabsorption of calcium in the kidneys. By the same note, it increases phosphate excretion in the kidneys, and this is important as calcium and phosphate can bind together, forming calcium phosphate, and we don't want that. So it increases the phosphate excretion. And it promotes the action of vitamin D, and vitamin D is important as it can be used to increase the calcium levels. And it does this by increasing the rate at which vitamin D is converted to its most physiologically active state. So also the second hormone that helps regulate calcium is vitamin D, and vitamin D does this by increasing calcium uptake from the gut. It also increases phosphate absorption from the gut, unlike parathyroid hormone, which increases phosphate excretion from the kidneys. Now, parathyroid hormone doesn't work on the intestines; it's principally kidneys and bones. Whereas we see vitamin D, it works on the intestines. And it also works on the bones. It increases osteoclast activity, a bit like parathyroid hormone, and this will increase the calcium levels. And then we have a hormone, calcitonin, and this is secreted by the parafollicular cells of the thyroid gland, and this, in contrast to vitamin D and parathyroid hormone, will lower the calcium, and it is not normally secreted in the body. It's only secreted in very high levels of calcium where your body says, oh, we'll secrete this from the parafollicular C cells, and normally it would not be secreted. So first of all, what is high calcium and what causes it? Well, of course, it's self-explanatory. It's high serum calcium. Well, that means the calcium, we're looking at the calcium in the blood. And the principal causes is malignancy. And malignancy is probably the most common cause in hospital for high calcium. And another common cause is primary hyperparathyroidism, which is probably the most common cause outside hospital. There's other causes of high calcium, such as sarcoidosis, myeloma, and a lot of vitamin D administration. And what are the principal symptoms of high calcium? Well, I'm sure you've all heard of the bones, stones, groans, and moans. Memory aid, and this is to remember the symptoms of high calcium. So bones, you're getting bone pain. Stones, you're getting kidney stones. And groans, you're getting abdominal pain, pancreatitis. And moans, you're getting depression and behavioral disturbances. And what investigations can we use in high calcium? Well, you'd want to look at the parathyroid hormone. See, do they have primary hypoparathyroidism? Is there a lot of parathyroid hormone being secreted, causing the calcium to go up? You look at the vitamin D again. Is there a lot of vitamin D causing increased calcium? It could be useful to do a myeloma screen, and ECG and chest X-ray. And of course, sarcoidosis is a cause of raised calcium. And what is the treatment? Well, you'd want to treat the underlying cause. Maybe it is malignancy, and you'd want to treat that. Rehydration, because they're obviously dehydrated with high calcium, and you can use bisphosphonates to lower calcium. And what about low calcium? Hypercalcemia. This is a reduction in the serum calcium levels, and it can be caused by vitamin D deficiency or post-surgery. For example, surgery around the thyroids and parathyroid glands. You can get a transient low calcium after those types of surgeries. And vitamin D deficiency. Also, chronic kidney disease can cause low calcium. It's more uncommon cause. And what are the signs of low calcium? Well, there's two particular signs. Trousseau's sign, where there's carpal spasm by inflating the blood pressure cuff, and chopstick sign, which is facial spasm on tapping the facial nerve. and those are signs which commonly appear in exams. There's also a lot of clinical features, and you get numbness at the fingers and toes, numbness around the mouth, muscle cramps, and very rarely you get laryngeal spasm in very severe cases. And what is the treatment? Well, you want to check is the magnesium low, and in that case you'd replace the magnesium as well. And also you could use calcium tablets such as Adcal D3. But if the serum calcium falls below 1.9, you'd use IV calcium replacement such as IV calcium gluconate. And you have to be aware also of the different things causing low calcium and high calcium. As we've mentioned, the common causes of high calcium is malignancy or hyperparathyroidism, vitamin D increase. Drugs such as thiazide diuretics can also cause increased calcium, and also you get increased calcium in Addison's. You get increased calcium in antacids if they're taking thiazide diuretics or antacids for reflux, Paget's disease, and sometimes even in thyrotoxicosis. So also, just to add on to what I said, in high calcium you could do TFTs as well. And in low calcium, this would be commonly caused by low magnesium and maybe vitamin D deficiency and post-surgery. So thank you very much for listening. That concludes my video. If you like this video, don't forget to hit the like button and subscribe to this channel for more medical education videos.